Okay. All right, I don't currently see anyone else in the waiting room. I'll try to admit if they come in though. So, all right, we can get started. So thanks everybody for coming to the, oh, there's a few more, of course, right when I start. Coming to the quarterly DHS OCI healthcare coverage partnership meeting, kind of a mouthful. We are hopeful that this will be more of a forum going forward. I know in the past we had called this the advisory council. So feel free to share your feedback and input. We sent ahead the agenda and some of the work group reporting materials beforehand so that if you do have comments or questions that you're able to share those. That's really the hope coming out of these meetings, is that the work groups can get other people's input and make sure that, you know, we have all the resources we possibly can to get this mission achieved of getting more people access to healthcare coverage. So I am going to go through the agenda quick. So as I mentioned in the agenda we sent around, I'll do a quick process improvement update. I know that's something we've touched on in the last couple of quarterly meetings. We will then go right into the work group report outs and discussion, and then some agency updates. I have a quick update from OCI, and then I don't know who is actually on from DHS, but we will hopefully get a quick update from their agency as well. And then any other questions or feedback that other folks have on the partnership work. So this graphic, I know it's a little cut off on one side. This was something we showed at the last meeting. So just as a recap, this is kind of the new structure that we have based on some of the improvements we've tried to put into place to make sure that this partnership is really effective. So we essentially added this, executive steering committee that kind of works as a hub for all of the work group chairs to get together and touch base, amongst themselves, but also work with then me from OCI and DHS to make sure that there's agency buy-in and support for their work. So those are some of the steering committee responsibilities. As I mentioned, making sure they have our feedback, also just providing leadership, decision-making, and really being the subject matter experts. I mean, these folks are the chairs of the work groups for a reason, so that they can make sure that not only is their work group doing the best that they can, but that, they can offer input and support across to the other work groups as well. And make sure that they can collaborate across. There are always places where something that, the data committee is doing can help inform what the marketing committee might want to do and some of those things, so that we're not working in silos. And so we've been meeting regularly as a steering committee to try to move those things forward for the work groups to be as effective and as efficiently effective as possible. And so for everyone's, insight on that, then just as a recap, I know that a lot of folks are only in one work group, or they're not actively currently in any work group. So this is just to give you a little information about where everyone's coming from. So Jim Jones from the Department of Health Services, and then myself from OCI. And then we have Allison from Covering Wisconsin, Melissa from Common Ground Healthcare is the data chair, Bobby Peterson, ABC for Health is the workforce chair, Courtney Harris for the outreach work group chair, and Stephanie Sievers for the marketing work group chair. So just if you're not on any of those work groups, and also if you would like to get involved in any of those work groups, and also once you hear these report outs later, if you want to get involved, certainly speak up and reach out. I think we're always looking for more expertise and new perspectives to participate in those conversations at the work group level. So then, speaking of work groups, we'll jump into some of the updates. So the first one that we have is the update from the workforce and capacity work group. So I'll run the slides, but I'll hand it over to Bobby to walk us through what this work group's been doing and get all of your feedback on that.
Thank you. Can you hear me?
Yep, we can hear you.
Good, perfect. So yes, the workforce and capacity work group. We have a couple of slides that we'll share, but it's broken into two parts. One is some discussion and description, a visual description of a virtual consumer assistance hub, really looking at ways to help people through the system of healthcare coverage and to the level of assistance that they might require from a very broad sort of mobilizer perspective, creating a large funnel at the top, getting as many people into the system as possible for help, and then directing them to the right referral source, and then ongoing levels of assistance. And then a virtual workforce training portal, because it's going to be important to make sure that we have ongoing support and assistance and training for individuals that are part of this system. We know that we've got really important component pieces right now, so none of this is from scratch build, but really trying to put together the pieces of some strong programs and services that we have in Wisconsin and building off that and building off the current capacity. So if we can look at the first visualization, Sarah, I can talk us through it. So this is a consumer assistance hub with some technology strategies identified. We look across the top population needs and coverage areas, and people might think, well, this is way beyond what we do for the marketplace or for Medicaid. But people call for a variety of reasons and assistance and making sure that we direct them to the right place. So at our steering committee, we talked about really creating a really large funnel to try and pull in as many folks as possible and getting them to the right place. And I think that's been our experience at ABC for Health. Probably 20 to 30% of people that contact us at times, we help them and stabilize them, their situation, and get them to an ADRC or to the Board on Aging and Long-Term Care or to Covering Wisconsin or another source. But that initial opportunity to pull people in, if we look at all this, these programs are siloized in many ways, and the problem that we see is people crossing between programs, income changes, family size changes, aging, tribal status, immigration status. All those variables can change the source of assistance for your healthcare coverage and your healthcare. So people are working right now through a variety of different ways to locate this information through web searches. Wiscovered.com is an important step in trying to help provide some information and resources and assistance. The agency sites and a lot of our partner sites are working to try and direct people, but I think we can even do a better job of coordinating it and creating a virtual consumer assistance hub that helps with this effort. There are some tools that we currently use, big picture sorting type tools. We have a FPL calculator that we use a lot for people just to go in and get a quick snapshot of what their income is. And it can be broken down for Marketplace or for Medicaid. We saw a demo of an enrollment saver tool that Covering Wisconsin has developed, which is promising and offers opportunities. As we get a little further into it, we think about the access.wisconsin.gov Am I Eligible tool. And we had some really good discussion as a part of the steering committee about how can we think about ways of building off that. There was some vision for this that Jim Jones described more than 10 years ago that was really helping to build this into a more robust tool to help people identify assistance, direct them to resources. So this really could be an important piece of a virtual hub and making sure that people get to the right assistance at the right time. We've done some demos of our First Check Wisconsin tool, which is a self-directed tool that would allow people to do some initial review of their eligibility and identify the assistance that they might need. We know that the assistance that people need too is not something that's just sort of a one-shot deal, that especially for health disparity populations. So for folks that we're going to be providing additional assistance to, that we're not referring out for direct assistance to the ADRC, to a senior disability bench spec, or ombuds or HMO member advocate, those are the folks that we want to make sure we're providing assistance for some of the areas that don't have direct assistance right now. And those cases can be at an intermediate or more advanced level of complexity, at least as how we have it demonstrated here in the model. We know that health disparity populations need ongoing assistance, and we're discussing ways of building in features of health benefits checkups for those folks so that it's regular opportunities to check in on benefits, on income, on other eligibility issues that are emerging to try and get in front of this, to really apply a public health approach to health benefits and services, and making sure that we're anticipating some of the things that we know. We know how old, if we get the information, we'll know the age of family members. We know that there might be income disruptions from self-employment. We know that there might be changes in immigration status for family members. And so some of those things we can track and help record and build a healthcare coverage record for some of the clients. And the tool that we use at ABC for Health is Advocacy, and it really is a good tool for benefits management and building a health coverage record. So that's a bit of a snapshot. This is really an intent to try and build on some of the existing tools that exist out there. We were very encouraged by when Jim Jones told us that access.wisconsin.gov is something to explore, and I think the work group wants to look into that further. Are there ways of helping to improve the capacity of that? But then thinking about this structure of a virtual assistance hub at all these different service levels, we do know that we need to think about training, and that'll be the next slide. And I'll talk about that, and then if there's any questions, I don't know if you want to save those for the end. So when we looked at training portals, we really looked at a lot of different training portals, including the DHS Learning Center for training new workers. We just used our Gurus training program here because it's the one we were the most familiar with, one that we built working with National Institute of Health and Institute on Minority Health and Health Disparities over a number of years, thinking about teaching and training and measuring some of those, that learning capacity. And so when we look at this, we think, you know, we don't need to train people to the level of being an expert in this information. But we do need to make sure that at the intro level, at the beginning level, basic level, there's great issue spotting and getting people to the right place at the right time. Basic training would be issue spotting training, understanding of Medicare, Marketplace, some of the other programs that are used quite a bit. But there has to be ongoing continuing education, refreshers, and a link to updated information. Intermediate, of course, is going to be a little bit more advanced, and then obviously advanced and complex cases. Again, when we look at the landscape of folks out there, we have some very well-trained folks currently, but you know, do they have the training across the spectrum at a basic and intermediate and advanced level? So we you know, at least proposed thinking about doing some type of initial learner assessment so that you can gain some level of understanding of what the person's level of competence is at these different training areas: public health, private health, and of course skills. And the skills probably should come first because that's the most important: cultural competency, empathy, working with people that may have mental illness and other challenges, understanding concerns about immigrant populations. Those are all really important fundamentals to be thinking about. So that initial learner assessment helps us understand where a person is at on sort of the knowledge continuum, and then we can design and integrate on-demand training through an online portal for people to help them meet a level of competency. And we'd be measuring both pre and post a learning period so that you could see any gains and increases in competency and assessment. It's something that we spent a fair amount of time on, but it's not the only model out there. Again, we're putting it here because we think that some of the elements of this at least describe ways of building on systems that we have, having different levels of training, looking at ways of the key areas around healthcare coverage that we need to train on, and ways to measure and track some of the program participants in it. We hope that this, you know, results in some anticipated outcomes of really promoting health equity and reducing health disparities. Improving continuity of coverage will improve continuity of care. Less churn on and off programs, reducing uncompensated care, improving health of consumers and the community as well. And I think efficiencies and cost savings is hopefully a result of this. I think tying these things together is an important opportunity. And some of the things I think we talked about at some of our very earliest meetings.
Thanks, Bobby. Does anyone have any questions or feedback on what that work group is working on? We also do have a time at the end, so can discuss that as well. Okay. All right, well then we will go into the report from the data work group, and I'm going to hand it over to Melissa.
Thanks, Sarah. Hi, everyone. I wanted to report on some of the work that has been done by the data work group since our last quarterly meeting. Kind of at the 5,000 foot level, the data work group is now in the final throes of defining a set of SMART goals that will help steer our work in the coming year. And those SMART goals are summarized in the read ahead materials that were sent out, and they're going to be finalized in the next couple weeks. So once final, I will be sharing those out with the other work groups and happy to share them out with any other stakeholder that is looking for them. And happy to answer any questions about those if you have them today. And then you'll note that one of our goals is an upcoming event that we will be putting on in concert with OCI that is intended to help stakeholders better understand data that exists out there, where it is, what it means, and so on. And we've been working within our work group and with OCI to fill in some of the data gaps and build some resources which we plan to introduce at this event. So if stakeholders have input for us as far as what they want to see out of such an event, now would be a great time to let us know. And then you'll see from the slides that I included a couple other important goals that we'll be working on in the coming months. Both are things we've been working on for some time, but data initiatives have a long tail. And I think we're getting closer to moving some of these things forward. The first relates to Medicaid data, which is, of course, very important when it comes to understanding the big picture about where people are getting coverage and what's going on in Wisconsin. But it's also going to be critical as we come to the end of the public health emergency and the work we'll be doing to keep people covered. And then we're also working on KPIs in concert with some of the strategic planning work that the steering committee has been doing. And that is really aimed at making sure we're tracking and measuring progress toward our goals when it comes to coverage. And then the last thing I wanted to talk about is something that OCI has on its agenda to discuss a little bit later in this meeting, which is a federal grant that they have applied for that would support a few different initiatives. One of them being the data dashboard that is mentioned here, and the other one being a market scan initiative, also featured in the slides. I wanted the partnership to know that the data work group is not only interested in making coverage data available and more accessible to people, but also we have a strong desire to try and uncover data to help us go farther and try to understand why Wisconsinites remain uninsured or underinsured when they might have better options. So if OCI can secure the funding that is needed to do the market scan, we're hoping that we can collect the data that we need to start to understand, some of the root causes of the gaps in coverage, and go beyond just understanding, who the uninsured are or where they are. So we also welcome any input on this front, as I feel that we're just kind of at the beginning of that work, and it's going to go on for a long time. So thank you, everyone.
Thanks, Melissa. Did anybody have comments on what the data work group is working on, or questions, ideas on data that you'd like to see discussed, or data gaps that you'd like to see discussed at a public event about that? I don't see anybody unmuting. Okay. And then I actually had a couple other data work group things. These are the things that Melissa touched on as well. And I'll mention in our agency update as well where we are on the grant. So then we will go to the outreach and education work groups report next, and I'll hand it over to Courtney.
Hi, thanks, Sarah. Can you hear me all right?
Yep.
Okay, wonderful. Well, thank you for having me. This is actually, I'm Courtney Harris, and I'm with Covering Wisconsin, and this is my first partnership council meeting. So I'm happy to be with the group and looking forward to continuing to work with you all. I wanted to just kind of share two of the outreach and education work groups kind of key priority areas in the hopes of gathering some feedback and input from this group. And I'll put my email address in the chat in case anyone wants to send feedback outside of the meeting. I would definitely be interested in hearing from you. Since our last council meeting and kind of over the course of the last several months, the outreach and education work group has continued to do a lot of work reaching out to kind of key community partners and developing relationships with groups throughout the state to participate in our work group and to help us out on some of our key priority areas. And the first kind of priority that I wanted to share with everybody today is something that I believe was covered at the last partnership council meeting, but is kind of a focused outreach effort in the 5-county area that we actually identified thanks to data from Melissa and the data work group as having the highest uninsured rates in the state. And you'll see those 5 counties on the screen here. And to Melissa's point just now, we have some great input or great data on who is uninsured throughout our state. But one of the barriers that we have or challenges that we have is figuring out the reasons behind some of that uninsurance and just diving deeper into some of the true barriers and challenges that folks have in accessing coverage and in using that coverage effectively throughout the state and specifically in some of our highest uninsured areas of the state. And so until we can get some additional data on some of those key insights, the outreach and education work group is trying to reach out to key partner groups in these 5 counties to gather insights from folks on the ground to get a better understanding of the barriers that consumers are facing to accessing coverage in these counties to help us tailor an outreach effort in those areas and just generally get a better understanding of what might be going on in these counties leading to this higher uninsured rate. We have some good data on demographics in these counties and have identified that there's a high concentration, for example, of members of tribal nations and of the Amish and Mennonite community. So we're reaching out in particular to partners in our tribal nations in these areas and trying to connect with key partners who have connections to the Amish and Mennonite communities in particular, but are really interested in additional kind of statewide or local partners that you all might recommend that we connect with as a work group to continue to gain insight into what is going on the ground in these counties. So I will open it up in case anyone has feedback on this right now. Otherwise, we can wait till the end, and I'll also put my email address in the chat.
Feel free to unmute yourself, anyone, if you have comments or feedback. We'd like there to be, a dialogue here. So you're certainly open to chiming in if you have thoughts on this.
Absolutely. And Donna made a comment that we're focusing on counties with the highest rates of uninsured, but that the absolute numbers of uninsured are certainly the highest in Milwaukee County and other urban counties. And so we're continuing to try to bring additional membership into the outreach and education work group from Milwaukee County in particular to continue our work in our more urban counties as we also focus on this 5-county area. Since the last meeting, this may have been an update. We did have Cheryl Isbell from Milwaukee Health Services join our work group as an ongoing member, and she has been really a great new member of the work group to help bring us some key insights into kind of what's going on with MCAN and efforts at outreach and enrollment in the Milwaukee area. But are certainly interested in additional partners joining us from MCAN as well. And I know we'll have some time at the end, so I'm just going to move on to my next key priority area, and then we can come back to this. Obviously, as Melissa mentioned, another just really key priority for the outreach and education work group and the enrollment assistance community throughout the state right now is planning for the end of the public health emergency and trying to identify the types of data that would be necessary to help inform our outreach and education efforts, but also making recommendations to our state partners in terms of kind of from a stakeholder perspective, what we would recommend DHS consider as we get closer to the end of the public health emergency, things like communications, considerations, types of communication that would be helpful to enhance and potentially include, and what might be beneficial to include in those communication efforts, but also just kind of from a workforce capacity perspective, bringing on and training additional enrollment assisters to help support the state when it comes to outreach and the enrollment effort that will be necessary at the end of the public health emergency as folks are rolling off of Medicaid coverage and needing to find other coverage at that time. So we will continue to have this probably on our agenda for this group over the next several months. And again, I'll include my email in the chat if you have specific feedback you'd like to share outside of this group. But as we continue to identify outreach strategies and plans as a work group, but also as we continue to pull together recommendations for our state agency partners related to the end of the public health emergency, our work group is really interested in hearing what planning efforts are happening already in your organizations as it relates to this change, and also just what you're hearing from community members and partners locally about the Badger Creek continuous eligibility policy or the potential loss of coverage at the end of the public health emergency. I will give folks a minute if you have anything to add right now, but then again, I'll put my email address in the chat. And I think, and we'll see kind of how this shakes out. Sarah, I'm not sure who's on the line yet from DHS, but I did just want to highlight that our work group came together with the other work groups on the steering committee to make several recommendations to DHS for how to use American Rescue Plan funding to potentially help support outreach and enrollment efforts more broadly through open enrollment, but also really focused on this end of the public health emergency and dedicating specific funding to support outreach and broad-based marketing, but also enrollment assister capacity during the end of the PHE and beyond as well. So we are anxiously awaiting to hear from DHS kind of the results of that conversation and if there might be additional funding to support some of that work.
Great, thanks, Courtney. Doesn't look like there's anybody unmuting to speak. So we will go to the next work group report, which is marketing and promotions, and I will turn it over to Stephanie. You are, there you go.
I'm still muted. There we go. Okay.
Perfect.
So I wanted to start with what we have done for the SEP. So one of the things, just to give you a little bit of background for what we're going to ask for, one of the things that our group does is we get together and we talk about what are the promotional messages we want to use across the state and what can we all agree on, and we come together and we read various messages and we develop a plan. And then we use those messages on various types of outreach and enrollment messaging that goes out into the community. So this last time in the SEP, that ends August 15th, we did develop those messages. So Covering Wisconsin then took those messages and created a toolkit that stakeholders across the state could use and co-brand. OCI did the same. Theirs was a digital toolkit for social media. Covering Wisconsin had, in addition to social media flyers and outreach cards, and the backsides of the outreach cards could be personalized as well. And so that was in addition to what other kind of national materials that were available from healthcare.gov. We can go to the next one. In addition, we used our time together to create TV and radio scripts that were used for a 6-week statewide public education program campaign, or PEP, they call it. This is through the Wisconsin Broadcasters Association. And we were able to ask various community stakeholders to chip in so that with pooling our funds, we could pay for this. This is something that's only available to government and nonprofit organizations. And then filming and editing was a joint venture between Covering Wisconsin and OCI. And we were able to do both Spanish and English campaigns. So that's both Spanish radio across the state and Telemundo. And for the English, it's pretty much all the major stations for TV and radio. And that covers 90% of all broadcast stations in the state. So I listed here the groups that chipped in to make that funding and that campaign, I should say, to make the campaign possible. And I would just add on here, the one not listed is DHS, who provided funding to Covering Wisconsin for that. Okay. And just to give you an idea of the reach of this campaign, and this is just for the SEP, so this was not open enrollment, it's for this last SEP. So the numbers are a little bit different for the PEP campaign because it is a complete saturation across the state, but they estimate some reach numbers. They told me they really believe these numbers are low because of the complete saturation. So they suspect that just a month worth of, excuse me, got distracted by the chat. Just a month worth of ads on TV are going to reach 1 million consumers, and for radio, 2.5 million. So we think we at least reached 3.5 million because we had, 6-week campaign. And then I did list there the source that the data comes from, and that is from Nielsen. And then as a part of that, we're also able to do a social media campaign. And so that is, we get, for each week, we get a post that we can have then posted or reposted, and on all of the TV and radio stations that participate in the social media section of the Wisconsin Broadcasters Association. And not all of them have active social media accounts, but it's a pretty good reach. And with we've only done 5 posts because we couldn't align the 6 weeks that the campaign for TV and radio ran with the social media. They were full. So actually our last post will be the upcoming week on Monday or Tuesday. But our current reach is over 300,000. And that's with, we usually post, and then we let that gain a little steam, and then we do boost to help reach additional people. And we always post things that are some type of video or GIF, so there's movement. This image here is from a video. Okay, so with that in mind of the campaign we just did for the special enrollment period, we're asking for your help. We've got some key message ideas, and one of the things that I'm hearing from the stakeholders who participate in the marketing and promotions work group, I'm hearing 2 different sort of messages. And one is that people are exhausted of hearing about COVID. But one of our challenges is that we have to justify and give a legitimate reason why these marketplace prices seem so cheap. Because we did the last round of social media, the message that went out, it didn't say COVID relief, and a lot of the other messages did say COVID relief. And so it didn't say that, and we got more comments from people that, you know, you get what you pay for, it's too good to be true, it's a scam. And so we really want to avoid those pitfalls of people really thinking, oh, this is $10. Yeah, right. You can get health insurance for $10. We want to avoid those sort of pitfalls. So we're asking for feedback from the community. You know, do you think these messages would resonate with your community that you serve? And I'd really, really love some feedback. In fact, maybe you could just choose your top 3, if you like 3, and put them in the chat. I do believe there was a question. So while people look at the messages, I can read through them also, if that would be helpful. Yeah, so there was a question to provide a link to the video that I referenced, and I will do that here in a minute. I'm gonna have to just dig in my Box account, but I can do that before the end of the meeting. Okay, so I'll just read through these, and then maybe you can just, everyone can put in the chat your 3 favorite, or if you don't like any of those, maybe tell me why. Okay, new times, new prices, new you. 4 to 5 people can find a health insurance plan for $10 or less. Many even find plans for free with low out-of-pocket costs. It's time to take care of you. Health insurance prices are lower than ever before at healthcare.gov. Free checkups, cancer screenings, vaccines, and more. You may think these prices are too good to be true, but 4 to 5 people can find great health insurance plan for $10 or less. Take another look at healthcare.gov. Lost your health insurance? 4 to 5 people can find a plan for $10 or less. Many even find plans for free with low out-of-pocket costs. Call 211 and get free expert help. No health insurance from your job? Find a plan for as low as $10 a month at healthcare.gov. Many even find plans for free. Call 211 for free expert help. Does health insurance cost too much? Get free expert help from get help from an expert to find a better plan for less. So I would say the last 3, 4, 5, and 6 are recycled ones that we found work pretty well. So, and the top 3 are new ideas. And thank you. Thanks for those of you who are putting in your numbers.
Yeah, everyone put in, well, 2 is getting some love in the answers so far. We love to get feedback from, you know, we are sometimes always in this realm, and it's hard to see the perspective from an outsider who might be getting this message for the first time. So it's helpful to have all of you give us fresh eyes on it.
Sarah, this is Erin from Security Health Plan. I like some of the messaging that discusses the fact that you can get health plans for $10 or less. It might be too good to be true, taking another look at healthcare.gov, but I think it's nice to also get the call 211 in the messaging, just because then individuals can go and shop for themselves, or they can choose to call to get help. And so having both communication methods in the message might be helpful.
Yeah, we do in every post and every flyer, we do list 211.
Okay, so these messages would also have the 211 included, even though it's not part of the key message that you have on the screen.
Yes, yes. We always have a call to action. I should have been more specific. There's always a call to action. It may not be in the main message, but it's somewhere there.
This is Allison. Just wanted to mention, I think listening to and just observing and witnessing this marketing and promotions work group, I think it's just more thinking about the partnership as a whole. I think it's been really such a productive and effective way of bringing together the state and other stakeholders to think about these kinds of messages. And this very activity is just such an excellent way to quickly figure out how can we make messages that resonate with people at the moment, what they're thinking about, what might be meaningful. So thank you for your work that you're doing. I think this is really such a great thing.
Question. Hi, my name is Mohammed Abdursak. I'm a policy analyst at the Secretary's Office at DHS. I'm new in my role, so this is my first meeting here with the OCI. So quick question. So why can't we just mention the American Rescue Plan help like subsidize the premiums? Can we like kind of slide that in so it makes sense? So it's not too good to be true?
Yeah, one of the things that we did in this last round was Kelsey from OCI created a stamp that was like American Rescue Plan Act, COVID relief. And we were using that a lot. And I like it because it doesn't necessarily mean we have to put COVID relief in the main message. It's more a stamp that's there to legitimize if people, are looking for something. But yeah, we also don't think if we just say American Rescue Plan Act that people will necessarily know what that is. So we still think the COVID relief language is necessary.
Okay.
But again, people are so tired of hearing about COVID. How do you balance this? Like, well, I have to legitimize why it's cheap or else it seems too good to be true. So, but thank you for your comments. And I did see Sue said important to distinguish this from non-ACA plan marketing. I'm not sure I understand the comment actually. We in the promotions and marketing work group are coming from the perspective of, for example, let me give an example. Covering Wisconsin during open enrollment, about 1/3 of all the people we enrolled during open enrollment who were brought in by promotions and marketing that happened at that time are Badger Care eligible. And so our idea is that you send out a big net and you scoop everyone in, whether they're marketplace or Badger Care eligible. So more people are enrolling at that time than during the year. And of course, that will not necessarily be true at the end of the public health emergency, but it is very true during open enrollment. So I'm not sure other than that, how to understand the non-ACA plan marketing. For private companies, maybe.
And Sue, feel free to unmute if you have clarification or have a, further feedback on what Stephanie just said. Okay. All right. Well, it looks like some of your old standby messages, Stephanie, got some support in the chat, and then as well as maybe it looks like 1 and 2. So, but yeah.
Great.
All right. Anybody have other feedback, questions about this message for the fall, or these messages? Okay. Do you have anything else from the marketing work group, Stephanie, that you would like to?
No, I don't think so. I will just say that we did, as Courtney had mentioned, we did also give DHS some suggestions for some of the promotions and marketing ideas during the end of the public health emergency. So
Great. All right. Well, thank you everybody for sharing your thoughts on that piece and all the work groups. So we'll go into some quick agency updates. So from the OCI perspective, something that Melissa mentioned earlier is we are pursuing a healthcare innovation grant through the federal government. This funding would be used, as she mentioned, to do a market scan, evaluate the state of the marketplace here so we can maybe better understand both the uninsured population and also the insured population and the nature of the plans that people are on, how many are on ACA compliant plans, things like that, understanding the scope of the short-term limited duration plans in Wisconsin. But then it would also be to develop a public relations campaign. As you all can see, we try to do as much, of a cohesive public relations campaign as we can. And Stephanie, with the work group and Kelsey and Derek at OCI, we all try to coordinate a message and do all of that work. But this funding would really help us get some outside support for that and make sure we're developing the best content and the best message that's going to work to particularly target the uninsured or underinsured population to get access to the plans that that they need to get the healthcare they need. So that grant is kind of an ongoing thing. Originally, that grant was intended to be awarded this spring. There have been some delays, and so we're sort of in a holding pattern right now, and just hopeful that we will get awarded this grant here in Wisconsin and be able to use that hopefully ahead of the fall open enrollment period. But of course, it would also support our work in getting people transitioned to other plans at the end of the public health emergency as well. So, and then I just want to mention from the state budget side, so really the only significant change that our agency saw was in continuing it to fully fund the Wisconsin Healthcare Stability Program. The legislature actually added some additional funding, and so we will have the option to go up to a higher cap in the reinsurance program, which the reinsurance program has been very successful in keeping rates low for Wisconsinites year over year, and also expanding choice by more plans participating in the market year over year. So we're glad to not only see the fully funded program, but in fact, even more a higher cap for what we are able to spend. And we get money from the federal government for that, as well as matching that with state funds up to the cap that has been determined. So now we'll be able to spend up to 230 million. It was previously 200. So that will be that'll be great, since we've seen such success with that program so far, to continue and build on that going forward. And that's really the only update from OCI. And I didn't have any slides for DHS. I'm not sure who is on from DHS that might be able to give us a quick agency update from their end.
It seems that I'm the only person from DHS here today.
Okay. Well, we may not have a DHS update for today then at this point. So we can just open it up to further discussion and questions from anybody else that may be on the meeting. Does anybody have?
Yeah, so
other
I
feedback?
so I
Yes.
wanted to follow up. So there is a mention of ARPA funding. So like kind of I want to take notes and you know, relay them to you know, my colleagues in DHS. So somebody mentioned something about ARPA funds. I just wanted to kind of like jot down some notes.
Yeah, I think it may have been, yeah, Courtney or Allison maybe have brought up ARPA funding.
Sure, I can just share a brief update. The steering committee came together to put forth a series of proposals, and we shared a document through Jim Jones with, I believe he presented it to the secretary's office, that covered some proposed investments from an outreach and enrollment perspective. Should DHS have additional funding to dedicate to an effort like that. So I'd be happy to follow up and share a little bit more about that, but it was kind of escalated via the steering committee, and it included you know, funding to expand marketing and promotions, potentially reinvigorating the regional enrollment networks, a proposal to use mini grants to support community mobilizer organizations, some dedicated funding for enrollment assistance groups, and then also specific funding to support the outreach, the workforce and capacity proposals that Bobby covered, and the health insurance literacy kind of education component work that the health insurance literacy team at Covering Wisconsin generally leads.
Okay, thank you for that question.
All right. Do others have questions about any of the work group reports or feedback on any of the things that the work groups are working on, or any resources that folks can share, you know, and as Courtney mentioned from outreach in terms of connecting in some of those uninsured counties with certain populations, or, you know, for the data work group in terms of getting access to some of the data gaps that we're looking to fill. I'm happy to go back to any slides if people would like to discuss a certain thing.
And this is Allison from Covering Wisconsin as well. People are thinking about that. I did want to just take the opportunity to also share, as we're talking about open enrollment coming up, as well as the public health emergency ending next year, and just any preparations that we can do for that. I think I used this forum, perhaps even the last meeting we had, to talk about the Federal Navigator Grant. I just wanted to give an update on that so people can think about that in terms of potential upcoming capacity, both for enrollment assistance as well as outreach, promotion, but primarily Navigator enrollment assistance. So Covering Wisconsin, as I mentioned the last time, did quite a bit of background to talk with others around the state to find out, make sure that we were well coordinated as a state, kind of similar as we work through this partnership, just making sure we're talking to each other, thinking about who might be applying, if there's others that wanted to apply with us. And through that process, I didn't learn of anybody else who was applying. Doesn't mean that it didn't happen. We did, as Covering Wisconsin, did apply. That went in early July. Thankfully, that's off my plate now. And now we wait. We wait until August 27th is when we're supposed to learn. Hopefully, it doesn't get delayed, as it sometimes happens. We will be covering the full state if we get awarded. It includes but Covering Wisconsin, as well as 8 subcontracts who are physically located in different places around the state. So that's really thrilling to, if you've been following the Federal Navigator grants at all over the past few years, you know that funding has gone quite up and down. It's been mostly down the past several years. And this would be a significant increase for Wisconsin, for consumers in the state, for agencies that do this work. So we're looking at potentially bringing in up to close to $2 million. Again, we don't know until we know. Fingers crossed, hopefully it all works out great, whether it's just Covering Wisconsin or whether it's Covering Wisconsin and others, or whatever ends up happening. We're looking forward to hearing about the results of that. And of course, we can give an update to this group. But hopefully things are in place such that navigators can both serve for open enrollment as well as supporting that end of the public health emergency. And from our work on the steering committee, I think my understanding was that while there isn't any definitive decision about how that public health emergency will unwind, as others have mentioned, the hope is that there will be ARPA dollars that could be made available to help support increased capacity, because that will be a significant lift in the state to help all those folks who are currently in Medicaid and Badger Care reassess their situation, potentially for many of them transition to new coverage types. So I think this group, this partnership is really the place to continue to figure out how can we make that as simple as possible. So just wanted to share those thoughts.
Thank you, Allison. Any other comments or questions from any other folks on the call?
So I didn't have the current videos on the website. I have the ones from open enrollment. So I put the website link, and that's coveringwi.org/CWI. Those pages are not in the menu. You have to go to them directly. And I will, after this meeting concludes, upload the current SEP videos, so you can see both.
Great. Thanks, Stephanie.
Mhm.
All right. Well, then I think we can wrap up this quarterly meeting, and we will see everybody again in 3 months or so. The steering committee will set the date for the next partnership forum and speak with you all then on what we're doing at that point for open enrollment. So, all right. Well, thank you, everybody.
Thank you.
Thank you.
Bye-bye.
Hi, a quick question one more time.
Oh, yes.
So is there a way to access the slides?
Sure. I can send you the
Okay.
slides. We also
Yeah.
record the meeting. So I'd be,
Okay, perfect.
yeah.
Yeah,
Yep.
thank you so much. Can I put my email in the chat? That's
Sure.
fine?
Yep. Do that.
Okay.
That would be great. I can send them to you.
There you go. Yeah, thank you very much.
All right. No, thank you for joining us. I'll send those shortly. Thanks.